Good morning, Deputy Minister. We are here today as part of the Provincial Working Group giving advice to you on the National Task Force on Long-Term Care. Today we have members from the Ministry of Long-Term Care, including Ranziba Nehrin, Director of Strategic Initiatives, Dilumi Rupasinghe, Director of Long-Term Care Response, Paula Tablon-Modica, Director of Capital Planning, and myself, Eva Falk, Director of Funding and Programs.
Members of the panel, as you are well aware, the COVID-19 crisis has renewed public concern about the state of long-term care in Canada, concerns that we've heard for decades. Military intervention during the first wave of the pandemic drew renewed media interest that revealed shocking realities like crowded facilities as well as shortages in PPE. Across Canada, 81% of the COVID-related deaths are happening in these facilities. That's double any OECD country. And as Canada contends with new variants and new waves in both public and private institutions, Ontario is also struggling to cope. Currently, there are 3,717 deaths, which means that the infection control plans in about 50% of facilities that have experienced outbreaks are not working. To compound this, around 80,000 long-term care residents, many living with complex needs, such as dementia, are suffering from a crisis level of understaffing, as well as many tract violations across these long-term care facilities. As well, we have to think about upcoming challenges. Currently, there are more people over 65 years of age than there are under 15 years of age. And this demographic reality is expected to continue well into the future. This means that adults with critical medical needs will be adding pressure to the already pressurized wait lists, wait times, needing to increase capacity as well as increase in staffing.
So we have two challenges at hand. The first is an acute crisis in the long-term care facilities because of COVID-19. And the second is a chronic one. COVID has exposed long-standing deficits in our long-term care system. People are dying and families are angry. And while these issues aren't in Ontario alone, we are the largest long-term care system in the country. And so we are under pressure to act what many are calling a national disgrace. This is a challenge, but it's also a strategic opportunity to tell a different story.
To begin reshaping Ontario's story, we recommend conditionally supporting the federal conversation on standards on long-term care. The benefits include being able to express our voice. The federal government has expressed frustration at the patchwork approach of long-term care in Canada, and therefore will move ahead regardless of Ontario's participation or not. Therefore, it's important for us to be at the table and protect our priorities. Secondly, joining the conversation would unlock critical funding that's needed to address the long-term care issues in Ontario, as well as other connected priorities, such as ending hallway healthcare. And in a country that is as intergovernmental as Canada, the whole is greater than the sum of its parts, which means that no specific jurisdiction has the answers to this question, and we will need to share best practices and data with each other to make meaningful impact. And lastly, this is an opportunity for Ontario to step into leadership as a systems transformations leader. This means that we will be able to push along the national conversation on adopting an alternate, holistic, integrated approach to long-term care. Considering our needs, we recommend that the following 4 conditions be applied to this conversation, starting with all provinces and territories must agree to a shared definition and standards of long-term care. This means that the eligibility as well as funding criteria will be clearly outlined in order to influence our future actions. Secondly, that the constitutional division of powers is respected so that we're able to create provincial autonomy that allows Ontario and other provinces and territories to align their health priorities with what they know to be their demographic and regional needs. Thirdly, we recommend that a per capita funding formula is proposed for all national initiatives. This proportional funding is good for Ontario, given the fact that we are one of the key drivers of Canada's economy. And lastly, as you will hear more about later, we recommend that dedicated funds are earmarked for home and community-based care so that we're able to make this transition smoothly.
And keeping Ontario's conditions in mind, our recommendation today is twofold. The first is to address our acute problem. So we're recommending continuing our work with healthcare system partners to accelerate our response to COVID-19. And the second is to tackle our chronic issue. We need to build system capacity and develop infrastructure with sustained cross-jurisdictional approach. This is an opportunity for us to work together with others to design a national standard of care that is affordable, universal, and equitable.
In order to respond to the COVID-19 issue, through our action plan, we made it a priority to protect our long-term care system and implemented many innovative solutions. We understand that our work to protect our seniors is not complete, but we are working towards it. We are expecting to have the COVID-19 Long-Term Care Commission's recommendations by April, and once we have this report in place, there's more work to be done. The understanding is that COVID-19 impacted the way it did was due to the deeply seated issues that we were attempting to fix prior to the pandemic. Our focus today is to create a foundational and fundamentally transformative solutions to address the chronic problem. We do this by building a framework that is in consideration of timely and optimum care for our citizens. Second, our government priorities, as well as intergovernmental scalability. Finally, economical feasibility to ensure that Ontarians receive the best value for the investment. These are our foundations. There are 3 pillars that are built on these foundations, which will be our building blocks that will transform us from the traditional long-term care model into home and community-based care approach. Through this transformation, we'll be able to provide right care in the right place at the right time. Now we will take a look at the building blocks.
One of the critical pillars to success in long-term care is stable workforce. Ontario has said it loud and clear, there's just not enough staff within the long-term care sector. Even prior to COVID, on average, a resident would only receive 2.75 hours of direct care per day. And last year, we made a commitment to increase that to 4 hours of direct care by fiscal year 24-25. And even that means that we need even more long-term care workers in Ontario, especially personal support workers, as they make up over 58% of the long-term care workforce. Therefore, we recommend implementing a wage increase of $2 over a 3-year period with annual adjustments. This is to support staff retention as well as to expand recruitment and provide them the training that they need to be successful in this field. This approach is not only aligned with Ontario's open to job strategy, but is also scalable, and it also allows personal support workers to rush less and spend more time providing quality care to long-term care residents. Recognizing that this is a chronic staffing problem, we would benefit from federal funding to boost the wage increase to $4 per hour and to further expand our training program so that workers are equipped to meet the increasingly complex needs of our residents. Moving on to our another pillar of success is accountable management. Long-term care in Ontario is a diverse landscape made up of public, private, and not-for-profit actors. To standardize the operations across these facilities, we recommend working with our partners to create a culture shift through a 5-tiered risk model with escalating interventions ranging from increased inspections to fines to additional training requirements all the way to license revocation. This regional approach not only upholds value for money, but is also a scalable approach that is applicable to other provinces. And at the same time, we will be providing better care in better facilities. We would also propose seeking matching federal funding of $5 million annually to recruit and train our inspectors to conduct even more inspections.
Our final pillar is long-term care capacity. It's clear we don't have enough beds to meet the needs of Ontarians. Our facilities are old and are at max capacity. Therefore, we propose to invest in support for home and community-based care. This will ensure supports are available for Ontarians who need it. And this would include making the temporary home safety tax permanent, extending the eligibility criteria of the caregiver benefit tax to include caregivers of seniors, and we're introducing a technology tax credit for proper medical devices to monitor health at home. It will remove barriers and provides accessible care. This is scalable to other jurisdictions, as many are already moving towards home and community-based care, and the tax credit will reduce our red tape, aligning with our priorities. This policy is also economically feasible, as the funds are already earmarked in this year's budget. To address our ongoing infrastructure need for more beds, we are going to continue partnering with Health Systems and Infrastructure Ontario. We would seek federal support of $452 million annually to subsidize our renovations and building newer facilities. So altogether, with stable workforce, accountable management, and long-term care systems, we have chosen an evidence-based, action-oriented policy package that will provide Ontarians with direct relief and care. It will also protect, support, and restore trust in Ontario's long-term care system. We arrived at this policy package because it serves our interests and it is inexpensive, and in the long term, we're saving a lot more. And additionally, we're aligning with our government priorities. This is scalable to other jurisdictions, and ultimately, it'll elevate our standard of care. In the long term, our recommendation will provide the right care at the right place and at the right time. And this is going to set us up for success as an innovative leader in long-term care systems across the country. Outside of our recommended package, what you see here are the alternative options that we have explored. We can go back to this deck for you to consider.
Now that we have gone over through our strategic recommended policy package, it is also important to be considerate of the diverse landscape of long-term care across the country. This is why when we recommended our policy package, we took into consideration best practices from other provinces and territories. Our recommendation is scalable and certainly can be implemented across the country. For our implementation, in the short term, we continue to respond to the COVID-19 challenge. We also will implement the rapid long-term care hiring and training programs for our healthcare workers, and also start the recruitment and training for inspectors. In the midterm, when we have enough capacity, we will implement the risk-based compliance model for inspections. And we are looking forward to implementing and introducing the tax credit programs. We will continue to collect data because we want to make informed decisions and plan for future crises. In long term, we will continue to construct and invest on long-term care capacity. And we also will partner with educational institutions to support our personal care workers. We propose throughout the whole time to monitor COVID-19, as well as taking the initiative on pan-Canadian collaboration and data sharing. Now we will discuss the financial impact.
Allow me to take you through the financial impact. Starting at the top, to date, already our government has already committed $7.9 billion towards our ongoing COVID-19 in acute response. This includes testing, vaccines, and rapid recruitment, among many other items. Our recommendation is to invest an additional $283 million on recruiting and training, and an additional of $212 million in the salary increase program following and COVID to promote staff retention. We'll also invest $5 million to boost inspections, and while in the meantime, we'll make the home safety tax credit permanent that will make $30 million per year, including, and in addition, the home care technology tax credit, which will enable Ontarians to age in the comfort of their own homes while having the proper medical equipment to monitor their ongoing health. This will mean an additional investment of $505 million in fiscal year 2021-22, and a 5-year total of $2.2 billion. On the right side, we have delineated our minimum and optimal federal ask. If we can secure an additional of $864 million in fiscal year 21-22, we'll be able to double our impact in recruiting and training more personal support workers and raising compliance. And lastly, we'll be building in more long-term care spaces so that candidates on the wait list for long-term care can move into long-term care facility sooner. Ongoing funding is crucial to Ontario's path forward towards a sustainable long-term care sector. Our recommended approach will also support long-term economic benefits, including cost savings of $170 million per year from a reduction in the wait time and for hospital patients to move to long-term care facility. It will also support the creation of over 50,000 jobs in long-term care, as well as long-term savings as our long-term care homes become more equipped to tackle future epidemics.
So how will we know we're on the right track? Well, first of all, data collection is central to our strategy. And this is to ensure that everything is effectively managed and supported. In listening to Ontarians, we understand that success is captured through their experiences in the long-term care systems and their services that they receive. What you see here are the key performance indicators we're going to collect, such as resident and staff satisfactions and the number of inspectors trained. We're going to continue engaging with our key stakeholders by sharing our best practices to ensure that we're upholding a national standard of care.
We have also accounted for risk in our strategy. The one common theme that runs across our risk evaluation is that of stakeholder impact. So how will families, long-term care operators, and other key stakeholders receive our policy package? Through a standard stakeholder analysis, we have determined that a strong communications and engagement strategy will mitigate for most of the risks. I'd like to point out our hiring of LTC workers, the most severe risk in this policy package. What we recommend to mitigate this risk is to work with already existing programs and partners, such as Employment Ontario's Second Career Program, as well as focusing in on impacted sectors like the hospitality industry to meet our supply shortfall. Communications will also be extremely important in implementing this package. What we want to do here is appear as proactive, collaborative members in working on this national strategy, and also realize the collective power of provinces and territories to implement a long-term care plan. Special attention can be drawn to the municipalities, who are the leaders in transitioning us to home and community care, and we will echo this message and support them as they try to deliver dignified care for our seniors and persons with disabilities. Dignified care for our seniors and persons with disabilities. That's ultimately the goal. By making sure that we join the national conversation, we can reap integrated benefits for both our aging and healthcare strategies. This means creating conditions around a definition and standards for long-term care that are shared nationally, guaranteeing provincial autonomy so to make sure we can deliver on healthcare, a per capita funding strategy, as well as dedicated funds for home and community care. This will mean improved care delivery, and it will also lead to long-term savings. But to do all this, we need to follow an evidence-based and action-oriented plan, which we're doing right now in the COVID-19 response. With this response, we are making sure that Ontarians are safe and healthy through a vaccination approach, as well as screening and testing, as well as making sure that there is medical conditions that are followed for the acute treatment of COVID-19. To tackle the chronic issue, we are working to support the pillars of stable workforce, accountable management, as well as building capacity in both the existing facilities as well as home and community care. And these are supported by our foundational commitments around intergovernmental priorities, making sure that our options are scalable as well as appropriate to our government's priorities, that they are economically feasible, and that they also elevate a standard of care, which will eventually lead us towards creating a more comprehensive home and community-based care system. To close up, COVID-19 has shone a light on deeply complex and complicated issues in the long-term care sector. This means that we need to implement our plan, we need to conditionally enter the national conversation and improve funding agreements so that we can take this ongoing challenge and turn it into an opportunity to create nation-leading levels of the right care in the right place at the right time. Thank you, and we'll move to questions now.
Okay, thank you very much, team. Appreciate this briefing very much. I'm going to ask my colleagues if they've got comments or questions to offer you, starting with Susie McDonald and then Steve Orsini. Susie McDonald.
Well, thank you very much, colleagues, for this compelling presentation. I just want to make sure I really understand the financial ask at the federal level. So I think what you're proposing is that there would be a line by item per capita transfer for the items that you've outlined here. And I guess related to that, our province has already invested a tremendous amount in this. Why wouldn't we just make the ask directly of the feds? Why are we including an Ontario component? Shouldn't we go to the table and ask for everything and see what we don't get?
Absolutely. Thank you for those valid questions. And I'll ask our Director of Funding and Programs to take that on.
Thank you for this opportunity to answer this question. Absolutely, we see that in our path forward, we have already, as we have mentioned, committed a number of resources towards building long-term care sector. As part of our provincial ask, what we're really recommending is to meet our immediate needs. And what, as part of our discussions with federal, we would definitely recommend and seeking additional further support are to support our initiatives, recognizing that this will be a joint approach. We believe that federal will want to see that provincial is also taking on an active approach at tackling our own problems. So with that, this is why we have recommended both a provincial as well as a federal component to it. Thank you.
Okay, thank you. Steve Orsini.
Well, thank you very much for that presentation. I really like the fact that you've looked beyond long-term care as sort of the institutionalization of aging and included home care. But when we briefed the Premier, he's going to be very interested in what Premier Legault will think about this proposal, and Premier Kenny, and the idea that, you know, are we asking for enough? And two, are we getting too much into this specificity of telling the feds where the money should go when some provinces say, just give me the money. And so we will allocate it to what we think is important at that time. So I'll be interested in when we have those discussions with those two key provinces that the Premier's built relationships with, how do you think they're reacting, and what should the Premier say?
Absolutely, that's a great question. As you can see from the slide that's on just being displayed right now, our approach is informed by a very intensive jurisdictional scan. So we have tested all of the approaches that we have proposed, not just the policy package, but also the alternate approaches, and run them through and seen if there would be support across the other provinces and territories. So with regards to messages for Quebec and Alberta, we'll start with Quebec. Quebec has many of the programs where we will be drawing inspiration from, including the rapid training program. And as for Alberta, they have many of the similar geographic and demographic needs that we have, especially as it comes related to rural communities and alternate types of care. And so what we want to get across as our main message is that we are partners in working on this collaboratively, and also that it is in our best interest to work together so that we're able to elevate the national standard, being sensitive to the conditions that they are also bringing to the table. While their conditions might be, we don't want any federal involvement at all, it might help us to have some federal involvement, but it will require conversation, and we're prepared to take that on.
Okay, thank you very much, team. Go to Andre Fortier.
Yes, thank you for the presentation. I just want to follow on what Steve just said. So you're asking and you're proposing that the provincial government Ontario government put more money to match federal additional funds. But what the health minister will say to his colleague and the Premier, what other priorities are we going to sacrifice to finance this additional funding for health and for long-term care?
Absolutely. Thank you for that question. And I believe this is a two-part question. So I'll ask first our LTC response director to talk about what other priorities we have, and then our funding and programs director can come in about our cost efficiencies and long-term savings.
Thank you for the great question. Our government committed to ending hallway healthcare, as well as opening Ontario for business and long-term and to address the complex needs of long-term care. So by investing more in long-term care, we'll be able to address and accomplish our priority on ending hallway healthcare. Because as we know, Ontario has a bigger issue with hospital sector with hallway healthcare. And the main reason with that leading to hallway healthcare is the ALC patients who are supposed to be going into long-term care, but because there's a huge waiting list, they're staying in the hospital sector. And this is causing problems in the hospital, leading to hallway healthcare. So by investing more in long-term care capacity, we will be able to accomplish two priorities at one go, which is ending hallway healthcare, as well as providing better care for our seniors. And also, Ontario is open for business. So by providing this, we'll be able to open up the sector for private partners as well, while doing ongoing support and also enforcing more compliance. Thank you.
Okay, thank you very much. Was there going to be a second response there? Go ahead.
Yes, yes. So with regards to our long-term savings, really, as Dilumi has mentioned, there will be downward future savings, especially from reduction in the alternate level of care days, as well as we will be creating more jobs that will be allow Ontarians to come back to a restored economy sooner and faster. All right, there will also be investments on infrastructure, which will help to generate more jobs. And lastly, we will really save on the long run in terms of our pandemic costs. This has been a chronic problem that we realize that there is a need to put priority on. And in the meantime, we'll also work with our partners in health in order to realize as much efficiencies as possible in the long run, while working with other partnering ministries. Thank you.
Okay, thank you very much. Other comments or questions from my colleagues, Renelle or Janine? Okay, okay, let me ask one quick question then to the team. Your preferred approach is well worked out in excellent detail. I didn't get the same clarity around the alternatives. I didn't see really what other options you had seriously considered that might be worth our premier considering as well. Could you say a bit more about what the alternatives are to what you're proposing and why you didn't pick them?
Absolutely. As you understood from the presentation, our entire approach is built along the model, which is supported by the three foundational commitments around making sure it's scalable, making sure it's economically feasible, as well as elevating the level of care. So the reasons why we didn't pick them is because the options we presented as our policy package fit best. However, others we considered included for the stable workforce pillar, hiring from other provinces and territories, as well as increasing immigration. And if you would like to go into detail about any of those, I can do so.
Just more at a strategic level, like in big picture terms, in broad strokes. What else could we do? What else did the Premier's going to ask us? What else we could do, and we need to be able to tell him.
Absolutely. There are also other considerations that we have thought about in terms of rolling up nationally, and these have more flexibility as they are suited to more equity or based conditions. So these would include things like thinking through rural healthcare and the unique staffing and care challenges that come with that specific environment, as well as thinking through a technology solution. So creating some sort of fund so that we're able to co-fund innovative projects and use technology to enable better care, as well as taking in a holistic view and realizing that healthcare is a continuum and that it exists across many social determinants, not simply just what's happening in facilities or in home and community-based care. So we'd look at things like housing solutions and how we could integrate those. Also on a medical end, we're thinking about aligning these with the national dementia strategy so it's better well-informed. So from a strategic end, we'd like to create a higher holistic level thinking around the issue, but our policy proposal is specific to LTC.
Okay, thank you very much. Steve, you had one more comment or question? I see your hand up. Go ahead.
Again, thank you. I want to explore those conditions of Ontario participating in the national conversation. And I'm trying to understand the trade-off. So the province is prepared to support, to be at the table, to be part of a national solution, to define standards. And so our conditions to be at the table and to shape the standards is we want provincial autonomy. That could be conflicted by a national standard. But how is per capita funding? Is it unconditional beyond the standards? Is there a guarantee on the amount of the per capita funding? I know you've provided a fiscal framework, but I want to kind of understand how these conditions interact as we negotiate with other provinces and the federal government.
So we need a very quick answer, colleagues. Very quick answer.
Okay, I'll just quickly draw attention to the federal asks that are outlined in each of our policy proposals. In terms of the interactions that the federal government has with the provincial ask, it's that we are prepared to go forward to respond to this crisis on our own terms, but going forward with the federal ask will increase the scope of that response. And we don't want to be tied down in terms of administration. However, we would like equitable complementary funding packages. For example, we are asking for us to give the tax credit around senior home renovations, and complementary, we would ask for the federal government to also supply an caregiver credit as well. So with funding arrangements like that, we're trying to create more of a holistic model.